The month of October every year marks breast cancer awareness. Now, the World Health Organization, that's the WHO, said over 2 million people died of the condition worldwide in 2018. Now, Ghana recorded about 4,900 cases of the disease in 2018. Though breast cancer is common among women, some men also suffer it. In Ghana, about 1 to 2% of the cancer is found in men, and most of the patients are between 40 and 49 years. Now, health professionals say though breast cancer is curable, early diagnosis is important for treatment. There is more in this report by Adoley Moffatt.
Nearly 70% of women diagnosed with breast cancer in Ghana are at the advanced stages of the disease, especially due to low awareness, resulting in limited treatment success and high death rates. Each year, health organizations, NGOs, and some survivor associations create awareness on this type of cancer, but usually in women, as they are more at the risk of getting the disease. Interestingly, breast cancer is not limited to women only. Men also suffer from breast cancer. In Ghana, about 1 to 2% of cancer is found in men, and most of these cases fall between the ages of 40 and 49 years. In this report, we will want to focus on some men who have undergone breast cancer treatment and to know how they found out they had the disease.
Na actually na me feel pains krawo. Nti sana me ko report ma doctor. Fi men kwada bru menti se obanima krawo bi. Na ma busu musu bi no. Nti meti sana ya me yaw pa. But doctor na ka chem say good semen hunentem.
William Ahene, a 77-year-old man who was diagnosed of breast cancer at the age of 75, has undergone surgery and is currently on medication. His wife, Love Safro, describes to me how the journey has been so far.
Meteno, ayi kakra nwa. Eche say, sade no wo se mi ya nenya. Esi den no berema de okonya bribisa. Or the call hospital by that one also obey an operation today to be say nombra. The animal friend in a man, a shame kurang, saying you who and yes, doctor candy. The ampa crocodile or tam no sing. And a jar, many may bought to see a being a mass, a cotton fit no person and a jufa by 8 something in more than a buy. Check up no more and you go.
The cause of breast cancer is generally unknown. However, some risk factors associated with this disease are known. A risk factor is anything that increases your risk of developing the disease. In breast cancer, there are risk factors that the individual can control and others out of their control. The former includes smoking, alcohol consumption, and being overweight, especially women at their menopausal ages. In recent times, it has been discovered that oral contraceptive use appears to slightly increase a woman's risk for breast cancer, but only for a limited period of time. The factors outside of the individual's control includes gender, age, and family or personal history with the condition. Breast cancer can be treated, but it is only possible when the condition is detected early through screening. It is important to understand that breast cancer does not usually come or start inflicting pain on the patient. That is why it is important to be observant of the breast for changes that may be unusual. Kofi Asante has a family background of prostate cancer. He was surprised when he was diagnosed with breast cancer too. He tells me what alarmed him to go to the hospital for a checkup before he was diagnosed.
I realized that anytime I go to work and I come back to the house, I will see a black stain on my singlet from my left breast. When I press it, I don't get to know exactly where it's coming from. So it took some time, about 3 months, 4 months. One morning I wake up in the morning, I realized that my entire left breast was hard. The entire breast was hard. It was so scary. So as a man, I went to do self-medication. I went about this cholesterol. Example question, what are you take when you have boil? So I applied. So I realized that this time the entire breast, I have a big breast anyway because I'm fat. The entire breast came to normal, But where that's where the flow was coming from earlier, about that area, about 7 inches was hard, like a line. The length was about 7 inches, and the breadth was about, let's say, 1 centimeter. No, so sorry, 7 centimeters, 7 centimeters by the length, and then the 1 centimeter by the breadth. So I came back Kolebu here again. So that's when we do the same scan again.
Unfortunately, 60 to 70% of Ghanaian women report to the hospital late when the cancer cells might have spread to other parts of their body. But Vivian Jesisafo, a breast cancer survivor who is now the president of Peace and Love Survivors Association in Kumasi, has had her sister battle cancer, shares with me her journey.
When I was 47 years old, I was diagnosed with an early stage breast cancer. By then, I've never screened my breast before. I have to start chemotherapy after the operation. And honestly speaking, the chemotherapy is something, if you are not determined to survive, you along the line refuse it, because it has its own reactions to it. Vomiting, weakness, diarrhea, sore in the throat, and the loss of hair, a whole lot, the darkening of the skin and the nails.
According to resident clinical oncologist at the National Radiotherapy Oncology and Nuclear Medicine Center at Kolebu Teaching Hospital, Dr. Mervyn Boache Ajiman clarifies some symptoms of breast cancer. He also runs me through the sequence of treatment.
We have stage 1 to stage 4, and the stages also determine the survival rate at a particular point. Because the lower your stage, the higher the cure rates. So maybe majority of them will be able to live for a very long time. So let's say someone in stage 1, you have a probability of curing about 98% of them. But when you get to stage 4, which is the highest stage, at 5 years, only 20% will probably be alive. So the earlier you detect it and the earlier you treat, the higher the probability of curing the patient. With the symptoms, most of it varies. Some people may not have any particular symptoms. They may go from routine screening, and something will be seen on their mammogram or on examination, and based on that, they will have a biopsy done that will confirm breast cancer. That's one. Secondly, and those are the early people that you detect, so they come without symptoms. Others may also probably feel a mass in their breast, and on routine examination, probably feel a lump and they report for us to see.
He entreats the public to have a medical or clinical professional examine their breast periodically, as early detection certainly helps treatment and recovery.
There's a recommendation for doing a frequent screening, because from age 20 to 39, it's recommended that at least every month, as a lady, after 7 to 10 days after your menses, you should examine your breasts.
The root of breast cancer is generally unknown, but lifestyle and hereditary is associated with it. It is necessary to get screened at least once a month. Reporting for Citi News, I am Adoley Moffatt.